we feel that we have been left down because we don't understand why were we not prioritized. You remember, we were the ones that were in danger.
Winky Mqimbisa is an outreach nurse. She was very excited and relieved when she heard health workers are going to be vaccinated. She survived COVID-19 and didn't want to go through it again. But her excitement was soon dozed.
We are crying for the clinics because our clinics are about 52 in this metro. They haven't started yet, and we are not sure when are they going to start the entire community if it is difficult for the healthcare workers.
Her colleagues share similar sentiments.
When it comes to the vaccination, you find that we're a lot as healthcare workers. So we have healthcare workers, we have GAs, we have lots of categories in the hospital. So for them to take a number of people, it actually delays for some of us because I had to wait from night duty, then I had to go and wait there. So if it was easy for them to even come, even during the for night duty people, you understand, so that we can go there, so that they can accommodate everybody, So with that, it's just a little bit delaying.
The Eastern Cape public health sector employs more than 60,000 workers, including clinicians and general workers. But up to now, less than 26,000 have been vaccinated. The target is to vaccinate 200,000 healthcare workers and related workers in the province by the end of May.
Actually, the point is that there was an issue with the availability of the vaccine. Now, with this facility promising and committing to offer us more doses, I'm confident that we are ready to move with speed to roll out the vaccination, because it was not a matter of us not having a capacity, but it was a matter of the availability of the vaccine itself. Hence, we've received about 29,000, and already we were able to inoculate more than 23,000 people, the human resource of our health department.
The government will miss its target to vaccinate 67% of the population by the end of 2021. The plan is now to vaccinate 22 million citizens between November and February next year. This is where ASPEN and its vaccine production capability will emerge.
The majority of the vaccines of this facility in 2021 will be supplied to South Africa and the member states of the African Union. South Africa has agreement with Johnson & Johnson to deliver more than 30 million doses of the Janssen vaccine, and the first deliveries will be made in April 2021. The AU will receive over 200 million, and I've heard up to 400 million doses this morning.
Rural communities are also demanding to be included in the rollout. The Nelson Mandela Academic Hospital Clinical Research Unit in Namthat in the Eastern Cape says it needs to expand its capacity in order to deal with the volume of the next phase. The vaccine rollout also holds the promise of improving access to healthcare services in the rural communities.
I think while much of the planning to date is really just focused a lot on the vaccine site and the vaccinators, I think important to ensure that this is effective, particularly in rural and deep rural communities. There is a need to bring the community into the solution. I think at the moment we're really just looking at the community as subjects of the intervention rather than partners. What I would suggest the government, and particularly the Eastern Cape government, do now as we prepare for the mass rollout, is starting to trial some of these engagements in rural areas, like maybe by getting in touch with local community leaders, church pastors, traditional leadership, as well as traditional health practitioners, to work on the first phase of the vaccine, of mass vaccine rollouts. And for me, that is just about raising awareness.
President Ramaphosa said the second phase of the vaccine rollout will start in mid-May, with registration starting next month. Lerato Fekisi, SABC News, Gqeberha.